Zimbabweans will be vaccinated against COVID-19 courtesy of a donation by China. Now, those to benefit are 100,000 frontline workers, the elderly and people with underlying illnesses. Zimbabwe will receive about 200,000 doses of the two-shot Sinopharm vaccine. For more on this, we're joined on the line by foreign editor, SABC foreign editor, Sophie Mokoena. Sophie, a very good morning to you. All right, talk to us about, firstly, the details in terms of the arrival of the vaccine. What are we learning about that?
Well, what we do know now is that the plane from Zimbabwe did arrive in China in Beijing, and the consignment was loaded earlier on the plane, and then the cargo plane is now on its way perhaps to Zimbabwe. We expect the plane to land at around 3 a.m. in Zimbabwe, and the Minister of Health, who is also the Vice President in Zimbabwe, Constantino Chiwenga, will receive the consignment. SABC will be there, of course, to document the story. And from there, the reports from Zimbabwe is that it will then be another process of ensuring that they do their own internal checks and, verification and testing before it can be administered to the people who will be identified to receive the vaccine first. We know that there's currently conflicting reports in terms of how Zimbabwe wants to go about it, whether it will be frontline workers first or vulnerable people and senior people, which has kind of sparked some debate in terms of, is this because the government intends to vaccinate the government members who are senior or politicians who are senior.
Right.
It's not clear yet, but clearly the frontline workers will be part of the first group that will receive the vaccines. But we will hear tomorrow, perhaps Constantino Chiwenga, the Vice President, will make some remarks at the airport, and journalists will be able to ask clarity on how they're going to go about it, and perhaps the date or the day in which vaccination will commence.
Sophie, you witnessed firsthand the arrival of these vaccines in South Africa. What are you hearing with regards to the level of excitement, level of concern in Zimbabwe currently with the imminent arrival of their allotment?
Zimbabwe has gone through lots of challenges in terms of the citizens of that country, how they interpret what government is doing all the time. Of course, there are questions raised around the efficacy of this vaccine from China, because, China, like Russia, much as they are constantly giving updates in terms of where the process is, it is very difficult to really pin them down. They are not even available. You can call the CDC in China. They won't be available to speak to media. The same with Russia, the Sputnik, those who are manufacturing Sputnik, they are not available to really take questions on certain issues that people would want to raise. For example, when you talk about vaccines, the vaccines process and manufacturing goes through different trials. And those trials also determine whether the vaccine can be administered on humans. Therefore, we know that there were talks that the China and Sputnik have passed the stage 3. But some people are questioning the outcome because they feel that the outcomes of the trials were not really clear enough to inform whoever wants to use the vaccine in terms of efficacy. Not that it's poisonous or it can kill people, but whether it's effective.
Yeah.
And therefore, there's always those kind of questions that have been raised. Secondly, the main issue in Zimbabwe was also who is going to get the vaccine first. Yes, we hear about the frontline workers, but also there were reports that it might be similar, it might not be similar to how other countries have conducted vaccination in terms of the second group that is likely to receive. But now we hear that it is frontline workers, and senior citizens. So so there's going to be debate, but also generally all countries, there are people who believe in vaccines, there are people who don't believe in vaccines, and therefore it's not a unique issue in South Africa or anywhere in the world. In each and every country, there are people who are in denial, and there are those who would want vaccine as of yesterday.
I want to just explore apprehension around the world with regards to vaccines in a short while, but I want to discuss the variant, the 501YV2 variant. What are we learning about its prevalence in Zimbabwe?
Well, it is there, but we don't have a well-documented information in terms of how rife the variant is. What I know is that in Malawi, it is very, very rife. It has left a destruction. Many people have been infected. And I think tomorrow, with opening of borders, this is something that we have to look carefully on, perhaps to monitor that kind of movement of people, because we know right now in South Africa that's a dominant virus shape. It's not that one that we experienced during phase 1. This one now is dominant. And therefore, many people who are infected in South Africa with this variant, who might be asymptomatic, if they cross borders, if they meet with those people coming from other countries, there's going to be infection. And I can guarantee you, we will see a rise in infections in the SADC region with opening of borders, exportation of this variant. It is going to happen. My only hope is that I hope all the SADC countries, ministers of health, and perhaps the leaders have discussed this thing very well, because we are going to see that kind of a movement, because we know many people in the region are in South Africa or are looking for greener pastures in South Africa. There's going to be that movement. Others going to those neighboring countries from South Africa, South Africans. So that issue of infection, it might increase in the neighboring countries, and this variant is likely to make its way in the neighboring countries where it is not right. But I know Malawi has got a serious problem as we speak.
To talk to your point, I was listening to infectious disease expert Dr. Anthony Fauci the other day, and he said the best way to prevent viruses from mutating is preventing them from spreading from person to person. And you do that by public health measures and getting as many people vaccinated as quickly as you can, because viruses will not mutate if they don't replicate. Having said that, what are you hearing with regards to, we were talking about the apprehension to vaccines on the African continent? Does it linger heavily around the continent?
It does. It does. I mean, take for an example in South Africa. We wake up this morning with headlines that the frontline workers, healthcare workers, are questioning the wisdom of South Africa taking a decision to vaccinate frontline workers with the Johnson & Johnson vaccine. These 80,000 doses, which when you look at the program itself and how they are communicating it's almost like a trial or investigation. We give them, let's see what happens, So those kind of lingering questions in terms of what this animal is all about, how effective it is, and why only 80,000 doses. If you don't clarify those kind of questions, if the health workers are questioning the efficacy of these vaccines now, you can imagine ordinary people like ourselves, because we don't have a know-how, they know better. And therefore, that is why it is important for governments around the world to be clear when they communicate the current crisis that we face in terms of COVID-19. Now, if you want to hide certain facts, or you're not sure, or you don't speak in one voice, or you are not working in unison in terms of how this thing needs to be handled, you will have problems. For example, the issue of AstraZeneca, you have to be upfront what were the challenges and where to from here. Now tomorrow, we're looking at people who can buy it. No, it's not that bad. No, we can still use it. No. And time is running out, and people are beginning to question the issue of expiry dates and all of that. So you are creating a problem for vaccination program to get underway and for people to avail themselves. Because if people don't see people being vaccinated, then people will continue to discuss vaccination, and they will really make their own interpretation. And it is not a sin for people to question, because only when you question, you will have better information. But I think this egg dancing, of those who are supposed to be upfront with these things. I mean, the president during the State of the Nation, he spoke about this, but in passing. And so then this morning you hear frontline workers are saying, no, are we guinea pigs? When frontline workers are saying, are we guinea pigs? What must the nation say? And this thing is right. It's not only happening in South Africa, it is happening around the world. But of course, America and countries such as UK, they've started, they are well on course to meet the target. I mean, take for an example, Israel. Israel has vaccinated almost 90% of its population, not frontline workers. Only few denialists. And of course, it's not compulsory. But they have done a sterling job, 90% almost. So you can say, indeed, they have reached that target of vaccinating a number to kind of arrive at herd immunity. And therefore, we will be surprised when other countries are doing well. I think the issue of communication is very, very, very important, particularly even communicate in African languages, because majority of people in this country are African in the rural countryside. We can speak in English, it's fine, and all of that, and scientific concepts. We have to communicate in a simple, clear language so that people can avail themselves for vaccination, because you are not going to be able to force them to do so.
Yeah, and I guess there's a general rule is that no process benefits from the combined vacuum of no clear plan, no clear structure, and a lack of transparency. And it should be understood by governments around the world. Sophie Mokoena, as always, thank you very much indeed for your insight. Be well.
Thank you.